We've had so many patients. We even had Lisa that was just on here a few moments ago, and she was asking about if she has PAD, should her doctor be checking for CAD, and what are the tests that they should request? Because, the doctor is just telling her, hey, you don't have the angina. There's no reason to check your heart. But more than 40% of people who suffer a heart attack show no signs or obvious symptoms.
Yeah. So, this is an interesting question. And there are a lot of docs out there too that will do things like cardiac CTAs and things like that too. But the problem is this, though, we don't know what to do with that information. Like putting stents in that person with no symptoms and no, like, especially in the absence of actually having a heart attack, it doesn't seem to make people live longer. In fact, there is some risk of harm. But rather, what you're supposed to do with some of this information is to be more aggressive with the medications, and that certainly can increase your lifespan and really improve your outcomes. There's always going to be a time and place to do heart procedures, whether it be stents or bypass. But we don't want to do some of that stuff too early because you kind of like start the clock. And just like in the peripheral arterial disease, we talk about trying to improve walking to kind of improve collateralization. Well, the same thing is true in the heart as well, too. We want to use good medications and promote collateralization. And there are some people that got severe coronary artery disease, but they don't have any problems because they've got great collaterals and they've been doing very well. And they live a nice, long, and healthy life. But what you should do is like if you have CAD, we screen for PAD. If you have PAD, we certainly want to screen for CAD. In terms of screening for CAD, though, doing really aggressive tests, like doing routine stress tests, doing routine cardiac CTAs, at this point has not been shown to be beneficial. We're certainly studying it, and they're very much interested in trying to see whether or not identifying these people earlier will actually change their outcomes. But in my practice, a lot of times what I'll do is I'll do a calcium score. And I use a calcium score not so much to say, hey, do you have underlying coronary artery disease? It tells me you got a lot of inflammation. If you have a lot of inflammation, I'm going to be more aggressive with ways to reduce calcium buildup, like using statins or PCSK9 inhibitors and other medications to really reduce inflammation. I'm going to tell you to do more plant-based nutrition. I'm going to talk about lifestyle things that you can do. Now, certainly if you start developing symptoms, you start getting shortness of breath, you start having a drop-off in exercise tolerance, having other issues, we're going to start investigating more deeply. And what it is you want to develop a very close relationship with your doctor so that you communicate honestly what your symptoms are. A lot of people say they don't have any symptoms at all. A lot of times that's not true. It's you're not asking the right questions. And so being able to kind of identify and tease out things that are different than the norm, that's when we get triggered to go ahead. Let's do a test at that point. But we don't want to do routine testing because honestly, it creates a lot of anxiety. It also may lead to unnecessary procedures that can lead to harm. So you got to be careful about that.
The one thing when we talk to our patients, a patient comes to us and they say, hey, we were just diagnosed with PAD. I've actually had symptoms for a long time. I haven't been able to walk very much. I'm, definitely a claudicant. They want me on this rigorous walking program. And we've had several actually have a heart attack when they started the walking program because no one ever checked their heart and they weren't pushing it. They weren't getting themselves to a point where their blood was pumping up like they can actually push. So I'm always saying, hey, you know what? Before you start your regimented walking program, you might want to have an evaluation on your heart because you might not be pushing yourself to a point where it would trigger something. And then you start walking and bam.
Yeah, I mean, and that can certainly happen. A lot of times, some of those heart attacks could have been prevented with good medications as well, too, but people were never put on any of these medicines.
No.
So it turns out they had uncontrolled hypertension or high blood pressure. Heart rate was high. There's a lot of other abnormalities were just missed and not noticed because everyone was focused on the leg blockage, but not on the rest of the body, right? So that's the thing, though. You don't want to miss the forest for the trees, right? So you got to think about the big picture, think of a patient as a whole and not just as a blockage. It's like there's so much more to a person than just an individual body part.
Definitely. Do we have any other questions that are coming in from here? This has been a really good conversation.